The premier event for infection prevention and control is coming to San Antonio this June. APIC's annual conference brings you the latest research, innovative products, and practical knowledge to help you prevent infection. From inspiring keynotes to thought-provoking panel discussions, APIC 24 curates an extraordinary platform for knowledge exchange. Meet IPs from around the world who face the same daily challenges as you. If you work in infection prevention and control, you don't want to miss this event. Learn more and register to join us in person or virtually at annual.apic.org.
You are listening to the 5-Second Rule podcast presented by APIC, the Association for Professionals in Infection Control and Epidemiology. This podcast is produced by the APIC Communications Committee and is intended to be a conversation between our hosts and professionals practicing in the infection prevention and control industry. You will learn and be entertained, but most of all, we hope you will be inspired by our community and the work of our peers. And now, on to the show.
Welcome to the 5-Second Rule podcast. We are your hosts. I'm Kelly Holmes, and my preferred pronouns are she, her.
And I am Lerenza Howard, and my preferred pronouns are she, her.
Today we are speaking with Dr. Peter Hotez. As a vaccine scientist and an autism parent, Dr. Hotez has led national efforts to defend vaccines and to serve as an ardent champion of vaccines going up against a growing national anti-vaccine threat. An internationally recognized physician and scientist in neglected tropical diseases and vaccine development, he is Dean of the National School of Tropical Medicine and Professor of Pediatrics and Molecular Virology and Microbiology at Baylor College of Medicine and co-director of the Texas Children's Hospital Center for Vaccine Development. He was also APIC's Distinguished Scientist in 2022. Welcome, Dr. Hotez, and thank you for joining us today.
Oh, thanks for having me. Always love doing things with APIC. It's what you do is such an important organization, and it's always a privilege to be able to support your activities. As I said at the last APIC conference to several thousand participants, I call them all heroes because they really are public health heroes. So thanks for this opportunity.
Thank you for that.
Thank you, Dr. Hotez. I happened to be in attendance at that keynote address.
Absolutely, myself as well. It's absolutely an honor, as Kelly noted, to have you on the show. So I want to dive right into our questions that we're burning to ask you, Dr. Hotez. So now in the current state of where we are with the COVID-19 pandemic, of course, we've now transitioned to an endemic approach. The public health emergency, as we all are aware, has expired and is ended. So with that in mind, what are the key takeaways that you can share with us that you've attained from the COVID-19 pandemic? And overall, what have you learned?
Well, and first of all, I think we have to be careful about, calling it taking an endemic approach. And the reality is COVID-19 goes in peaks and valleys. And we are at risk, I think, for another potential peak or wave. I hope it's not as significant as past ones or anything like 2020, 2021, or 2022. But, as we're talking, the numbers are starting to go up again, and it seems to be associated with a hodgepodge of these XBB variants, which have a lot of potential for immune escape. I think the take home is that in the fall, we hope that a new XBB booster will become available in the United States, and I hope Americans take advantage of that. I'm a little worried because the uptake of the past one, the bivalent booster, has been overall pretty disappointing. Only about less than 20% of Americans have taken the first bivalent booster, and very few the second bivalent booster. So I don't know how much enthusiasm people are going to be for this new XBB booster. So I think there's going to be a lot of health education. I think in terms of, what we've learned is the importance of timely and accurate science communication, but also the benefits of vaccination, because I have a new book coming out called The Deadly Rise of Anti-Science, and how so many Americans have lost their lives because they refuse COVID vaccines. So I think another important lesson learned is remember the impact of anti-vaccine disinformation and how well organized it's become tragically and targeted towards individuals with deadly public health effects. So I think those are some of the big takeaways. So COVID's still with us. It may be going back up. I don't think it'll be as bad as past waves, but that still should not affect your individual health decision. If it's been a while since you've been boosted, remember the mRNA vaccines are not holding up quite as well as we'd like, and so to ensure you and your family stay safe and out of the hospital, you want to avail yourself of that booster when it becomes available.
Thank you for sharing that information. And in addition to that tidbit regarding making note of the endemic approach and noting that is, of course, ever so present with us, COVID-19, that is. So with that information in mind and any additional insights that you can share, what mitigating strategies can we as infection preventionists implement within our IPC programmings to ensure that we're better equipped to tackle emerging infections and future public health emergencies? Because, of course, scientists note that it's not if a pandemic will occur, it's when.
Yes, I think that's correct. I recently, earlier this summer, wrote an article for the Houston Chronicle, our local paper, entitled "Is COVID-19 just a warm-up act?" And what do I mean by that? Well, with COVID-19, that's our third major serious coronavirus epidemic or pandemic in this century. We've had the original SARS, severe acute respiratory syndrome, in 2002, and then we had Middle Eastern respiratory syndrome in 2012, now COVID-19, so 3 in less than 20 years. That means roughly every 7 years we should expect a major coronavirus. So by that logic, we should expect yet another one before the end of this decade, before 2030. And then don't forget we have other major respiratory pathogens like the zoonotic influenzas, avian flu or swine flu, and in addition to the pandemic influenza. So I worry about that. And then the third one that very few people talk about, which I've been kind of rattling the cage about, is viruses transmitted by mosquitoes and our other arthropods, particularly here in the southern states and on the U.S. Gulf Coast. Now as a consequence of climate change and urbanization and poverty, we have dengue fever with increasing frequency, likely chikungunya, Zika virus, even potentially yellow fever. So I think that's the new one I've been trying to get people to think about. And so APIC's going to have a very important role in helping us to be anticipatory about those public health emergencies and having training session for what we do is if and when those epidemics strike. And I think getting ready for that and not only in terms of public health capacity, but also communication capacity and getting the American people ready for it and also ready to accept immunizations. I worry that all of the anti-vaccine sentiments are now spilling over into all vaccines. And so the numbers that you're seeing of people taking bivalent boosters, for instance, which is so low, only 20%, is that a new reality that we're going to have a hard time getting Americans to accept vaccines? And so that's going to be extremely important.
I do agree with that, Dr. Hotez, that is a big potential challenge. So we did all face a lot of difficulties with 2020 and the pandemic, both with information and getting the correct information to the people who needed to implement it in the hospital settings, in the community settings. We learned a lot, with manufacturing and the distribution of resources and vaccines, hard lessons learned. And hearing you talk about what we need to be thinking of for the future. Do you think that we did ourselves some favors, at least, in kind of the pathways that we have formed and the lessons that we've learned about the distribution of both information and resources, that it could help us in these future public health emergency situations?
I think some things went well and others didn't, and taking lessons from both are going to be extremely important. So, for instance, if you look at our vaccine ecosystem here in the United States, it's heavily geared towards pediatric immunization. So the Centers for Disease Control and the FDA and the pediatric societies and the people who get pediatric training in their residencies, that's a pretty well-tuned ecosystem for immunization. Not so much adult immunizations.
Correct.
It's kind of caught us off guard, I think. And we saw that with Operation Warp Speed. The idea was, well, you load the boxes onto the back of the FedEx and UPS trucks, and then we'll figure it out. Well, it didn't really work very well, and I think that was really important when the Biden administration came on board. They realized that all we had were the pharmacy chains and the hospital systems, and especially in low-income neighborhoods where there were pharmacy deserts and there were no hospitals there. There was no system to immunize adults and doing the advocacy around it. So I think there was a pretty steep learning curve on how we do adult immunizations. Hopefully that will go better. But we'll see, because it's about to be tested again, because this fall, think about it. We're going to have a new XBB booster. We still have to persuade adults to get and kids, of course, to get their influenza immunizations. We have a new RSV, respiratory syncytial virus, coming online for adults. And we still have to get adults to take their Prevnar, their pneumococcal vaccine. I know I just got it. I just turned 65, so I got my Prevnar 20, and also to get Shingrix. And so that's a lot. And so we're looking at the need to create a whole new ecosystem for these adult immunizations. We're still not there yet. So I think that's going to be extremely important, getting the American people to understand that adult immunizations are just as important as pediatric immunizations, and that is going to be a challenge.
I do want to pick your brain about that a little bit more, but I wanted to ask first about the patent-free vaccines that you've been developing throughout your career, and helping us understand a little bit more about the factors that would influence the sustainability of those patent-free vaccines and making them available to the populations that need them.
Yeah, I think, if you look globally, through the Gavi Alliance, the Global Alliance of Vaccines and Immunization, that was launched in 2000 and supported by the Gates Foundation and multinational partners, and bringing the pharmaceutical companies and the World Health Organization, the UN, other UN agencies like UNICEF and World Bank. They have been working together to have a pretty good 20 plus year track record of vaccinating the world's children. But there are gaps, and amongst the gaps, there are certain diseases for which the big pharma companies are not going to make vaccines for, because they occur exclusively in resource-poor settings, diseases such as schistosomiasis or hookworm or Chagas disease or leishmaniasis. So that's what we tried to do here in the Texas Medical Center, which is the world's largest medical center, at Texas Children's Hospital and Baylor College of Medicine, setting up a school of tropical medicine and a center for vaccine development, which is co-headed by myself and my science partner for the last 20 plus years, Mary Elena Batazzi, and trying to make the vaccines that are falling through the gaps. And we've had some success in that. And for those diseases that I just mentioned, but also for coronaviruses, because at that time they were orphaned as well. Pre-pandemic, nobody cared about coronavirus vaccines, so we started doing that, and so that for SARS and MERS, and then when the COVID-19 sequence hit, we were able to pivot our program quickly to start making those vaccines as well, and we transferred them with no patent, minimizing strings attached to vaccine producers in India, Indonesia, Bangladesh, and other countries, and had a lot of success. Ultimately, our low-cost recombinant protein COVID technology, vaccine technology, reached 100 million doses administered. So that was important, I think, because we provide a proof of concept. You don't have to be a big pharma company to still do big things. And again, not to demonize the pharma companies. I think we don't want to make that mistake either. They still do a lot of important things, but not to depend exclusively on the big pharma companies, I think is an important message, and to find alternative pathways. And I think we were able to do that. Our vaccines reached some of the world's poorest people in large numbers for $2 to $3 a dose, and provide a proof of concept that there is another way to do that. And hopefully that'll provide important lessons learned as well.
I agree. Being able to share that life-saving technology with the world is so incredibly important and has really made such a difference, I think, in the battle against COVID, and hopefully for vaccines of the future. And then shifting our mindset, from we're done getting vaccines when we're 10 and we get, our second set of boosters before the fifth grade, and okay, now I'm done. But shifting that mindset as an adult that, okay, this is part of my health history that I have to keep up with to stay healthy, and then keep others who don't respond to vaccines healthy, and the very young and the immunocompromised. So how can IPs support this message for you in the fall? How can we continue to raise awareness and send the correct messaging to our patients and our staff? And then, in our private life too, with our family and our friends, you don't want to step on anybody's toes or get into a fight at the dinner table. So what are some of your suggestions on how to speak to those members of the community that we love as well?
Well, we do have important organizations that are getting good messages about vaccinations. And of course, APIC is an important one. And there are others. There's, the Vaccinate Your Family and Voices for Vaccines, and NVAC, the National Vaccine Advisory Committee, and the CDC gets a lot of important messages out there. I think the big problem is it's getting drowned out by the negative stuff. So it's not that. There's a lot of good effort going on to get important pro-vaccine positive messages out there. Vaccine Education Center at Children's Hospital of Philadelphia, the Vaxipedia and other websites, all great stuff. The problem is it's getting swamped by the negativity that's out there on social media, particularly on Twitter and other platforms. And so I do what I can, on my social media space and in my writings, but, how we put a cap on all of the anti-vaccine aggression is a really tough one to crack. And in the past, I could talk to parents because I do mostly pediatric vaccinations. In the past, I could talk to parents about the importance of vaccinating their kids and why the diseases they prevent, such as measles and pertussis, are deadly diseases. And most of the time that would work. Now there's been a shift, and the shift is people have started tying their political allegiance to not getting vaccinated. How do you manage that is still a head scratcher, and it's we have no choice but to figure this out, because if we really care about public health and saving lives, now that's part of it. I got my MD PhD in New York 40 years ago to be a vaccine scientist, and because I thought that was the highest expression of science for humanity. And I still feel that way, and I still do that. But now I've had to take on this other role of dismantling the anti-vaccine aggression, because that's part of it too now. And it's that one's really tough.
Thank you, Dr. Hotez, for sharing your insights. I definitely wanted to change the topic just a smidge as far as the future outlook for vaccines. So I was curious to know from your purview, can you expand and explain upon the future outlook or any future developments for vaccines? Are there any microbial targets or any new and up and coming vaccine technology that is currently in development? I know you noted the new RSV vaccine. So I'm curious to know your insights regarding that.
So what we're working on is we're now trying to develop the low-cost XBB booster version of our vaccine, because I think there's going to be a need for that. We're looking at a low-cost universal coronavirus vaccine for global health, which I'm very excited about. We have some ideas on that, and that's making good progress. So next generation vaccines, both using things like cutting edge mRNA and particle and adenovirus technologies, but also traditional technologies that you can plug and play in low and middle income countries. I think that's going to be important. I think building capacity for making vaccines, we need to expand that. We're still too dependent on the multinationals in North America and Europe. I think the Latin American countries underachieved during the pandemic. We should have seen more vaccines produced locally by vaccine producers in Mexico, Brazil, and in Argentina. That was disappointing. I think the Middle East underachieves. We should have seen more new vaccines coming out of some of the Arab Gulf countries and Israel as well. That didn't happen. The African continent's underachieving in making vaccines. So expanding that vaccine ecosystem, I think, is going to be absolutely critical. And then lastly, I think, now that these anti-vaccine groups have built up during the pandemic, it's not like they're going to fold the tent and go away. They're monetizing the internet. They're politically empowered. They have money and clout and a lot of political power. They're going to target all vaccinations. So, and I spoke about this at the end of last year with Dr. Tedros, the World Health Organization. We're going to have to figure out a way to deal with this monster now, all of this anti-vaccine aggression, and look at some political solutions and recognize that this is right up there with global terrorism or nuclear proliferation or cyber attacks or any of those other big societal threats. It's reached that stage, and we're not quite there yet. We don't quite see how anti-vaccine aggression has become now a major global security issue, and I think we have to recognize that.
Dr. Hotez, I know that you noted regarding the low-cost aspect of the vaccines. So I would like for you to, if you can, expound upon that. Is the goal to increase accessibility from the equitable aspect of that? I just really want to understand, or at least hear it from you, as far as the importance of it being low cost.
Yeah, it's a 1-2 punch of promoting vaccine equity and combating global vaccine hesitancy. In terms of promoting vaccine equity, there are multiple moving parts to that. One is to get some of these new technologies like mRNA, the cost down from the multinational pharma companies, but in parallel, building capacity locally so they can make their own vaccines at lower cost. So, for instance, our vaccines technology was made by Biological E in India and Biopharma in Indonesia for $2 to $3 a dose. And that's what you need to get vaccines distributed to large numbers of people in low and middle income countries. So I think that's only going to happen if we do a better job building capacity. And too often people think about it as just building factories. And one of the things I always point out that in some ways that's the least of it. In some way, and also the intellectual property is the least of it. It's the building the human capital to train people how to make vaccines at scale and under a quality umbrella with quality assurance, quality control. That's what takes time. And so I think there we're going to have to build that that human capital capacity. So we're inviting a lot of scientists globally into our labs to teach people how to make vaccines. We need more of that. And then the other flip side of all of this, the combating vaccine hesitancy, that we're still not really chipping away at in any meaningful way. And that's going to be very important.
Yes, I agree. You also mentioned, well, we've talked multiple times about getting the right information to the right people. And then as an individual, kind of being aware that there are two sides always being presented, and to kind of be mindful of what you are always reading and making sure that you're getting the correct information. You know, I'd listened to your recent AMA podcast, and you had mentioned in there giving Threads a try, or a new social media outlet to try to get the positive science out there. Have you tried it yet? Do you have any thoughts on social media platforms that could be helpful?
Well, I'm still sticking it out with Twitter for now, although it's not easy. Because the aggression is pretty rough. So I'm still on Twitter. You know, I have almost 500,000 followers on Twitter, and it's hard to reproduce that. So it's a great way to get the word out. The problem is now I've had to shut off all the responses because of all the death threats and all the Nazi imagery that's, and another bizarre imagery that's out there. And so it's certainly less than satisfactory. So I haven't tried Threads yet. Maybe I'll do that. One of the things that I say is when people talk about scientists doing public engagement or public health individuals, I say, you know, social media is just only one tool of mine. You know, I try also the podcasts like this, which are very important, the cable news channels. I write opinion pieces, even books, and increasingly for me, social media is the least satisfying of all of them, although I recognize it's important. So what happens if finally Twitter just becomes unusable, which is a possibility? I may try Threads, or I may just give social media a break for a while. And the health disinformation has gotten very sophisticated on its use of social media, not so much the good guys. And so either we need something different out there, or the good guys need also to up their game a bit.
Mm-hmm. The scientists have to find their way out of the lab and into social media with all of their important information. And I know it is a struggle.
Well, I'd say still stay in the lab. That's important too. But
right. Yeah, one foot in the lab and one foot.
But
yes.
finding a way to do this, we still haven't figured it out.
Dr. Hotez, thank you. And I am so curious, as we're navigating this post-pandemic world space, what are some of the things that are keeping you up at night?
Well, I think the way I think of this is we're not really in a post-pandemic world where we still have COVID-19 with us, and now the others are becoming a new normal. And so we will continue to be buffeted by new coronavirus pandemics. As I've mentioned, we've had 3 so far this century: SARS, MERS, now COVID-19. We'll have a 4th, I think, before the end of the decade. We'll have the zoonotic influenzas. We'll have the arbovirus infections, maybe other respiratory virus infections. So we have to understand why this is a new normal. And as I wrote in my last book, Preventing the Next Pandemic, it's a new normal for real reasons. It's happening because of this confluence of climate change with altered bat migrations. Bats are an important animal reservoir of viruses, as well as movements of livestock and people, and deforestation and increasing urbanization as the world coalesces into large megacities, which can easily promote widespread transmission and political instability and the anti-science activity. So all of that is kind of coming together. We're talking more about climate change lately, but I find climate change doesn't operate in isolation. It operates in concert with other social determinants. So the point is there is a new normal. And so how do we mitigate against that? I think one is to recognize that the biomedical scientists alone can't solve this. We've got to work better with our public health agencies, and we have to talk to our social science colleagues as well, because things like urbanization and deforestation and human migrations, we have to talk to the economists, the political scientists, the sociologists, the urban planners. So we need more of that kind of integrated dialogue and people coming from diverse backgrounds to help us understand that better. And I think that will certainly help. And then we also need to recognize that pandemics, the public health aspects of pandemics are just one aspect. These are now economic threats, they're global security threats, and treat them accordingly and bring in people, the leaders of the G20 economies, which account for 90% of the world's economies, together and stop treating pandemics purely as a health threat and recognize them for the global security consequences that they are.
So there needs to be, as you've noted, there needs to be a plethora of institutions collaborating together, such as social science, public health, and economics. So, Dr. Hotez, can you share what would that look like?
Well, I think at the university level, a couple of universities like Oxford University in the UK have created a whole pandemic threat institute, or a pandemic institute, where it's going to bring together people with coming from social science and humanities backgrounds in that uncomfortable dialogue with the biomedical scientists and the physicians and the public health experts. I think we need to do more of that at American universities. I mean, for instance, here in our Texas Medical Center, which is located across the street from Rice University and near the University of Houston, we should be engaged in this multi-sector pandemics threat institute. But, it's hard to get. Universities tend to be pretty siloed organizations, and we tend to be encouraged to write and speak and write both papers and grants for each other, not to cross disciplines. So I think changing our university infrastructure, I think that could help. We're still a ways off from that. So we need the leadership of college presidents for that. I also think within governments, whether it's state government or the federal government, creating those interdisciplinary agencies, I think could certainly be helpful. We saw some of that with the COVID response team in the Biden administration to kind of cut across those agencies. I think we need more of those kinds of collaborations because of the highly diverse and interdisciplinary nature of pandemics. But we're quick to fall back to the silos, and it clearly doesn't work for something that's not only a health threat, but a global security and an economic threat.
I agree. A multidisciplinary effort from the sciences, but not just on a national level. It has to be a global level. So logistically, getting that to work is incredibly important, but also very difficult. So, Dr. Hotez, you have written multiple books in the recent years. You have been nominated for a Nobel Peace Prize. You do multiple public speaking events, keynote addresses like the one that we saw. You're, teaching, educating the public, writing papers, doing the science, directing your lab. How do you balance all of this along with the hate that you receive? I think that it would be very high burnout status. So how do you maintain that balance in your life and keep finding your motivation?
Well, it's funny. I often get invited to these sort of work-life balance at meetings or or at various symposia. I get invited to work-life balance panels and that sort of stuff. And I almost always try to refuse because the truth is I'm not very balanced at all. And I tend to get very anxious when I go on vacation and don't know what to do with myself. And so I'm a horrible role model. I don't for a minute expect people who work in our vaccine center or school to follow my role model, but it's just me, very quirky, that I just don't handle vacations well. And
Oh my
fortunately, I've got a
gosh.
family that's put up with me all these years. I work 7 days a week. People say, well, you must not ever sleep. And I say it's not true. I get a full night's sleep every night, but I just tend not to take days off. And I don't see it even as work. I see it as just a passion. It's what I love doing. And but I think one of the messages is I've changed over time in what I do. I mean, I always knew I'd be a laboratory investigator making vaccines. Public engagement is not something I sought out initially, but it sort of fell on me because there was a vacuum. Nobody was talking about neglected tropical diseases. Nobody, I had a daughter with autism and intellectual disabilities, and there were all these false claims about vaccines causing autism. So I wrote the book, Vaccines Did Not Cause Rachel's Autism, because there was a gap there. And same with combating all of the anti-vaccine activism. And I do find it meaningful. But I've also changed what I do. I mean, I wasn't writing books 10, 12 years ago. And now I've got 5 single author books, including this new one, and found that it's something I love. And I'm learning. I'm still not a great writer. I'm not a terrible writer anymore, but I'm not a great writer by any means. And so teaching myself new things is always, and trying to learn new things. And, for this latest book on the deadly rise of anti-science, not only upping my game in writing, but also talking to people who in different fields. I had to talk to people like Ruth Ben-Gatt, the political scientist and historian, or people like Molly Jong-Fast, that to understand how this has become a political movement. And I love it. I love learning new things. And so I think it's this passion for learning and willing to kind of reinvent myself a bit by coming to Texas and becoming a writer, I think, has been very important. It's very important to freshen things up. I think that for me, that's been extremely important. But definitely not work-life balance. I'm definitely not the person you want on for that one.
I wanted to say, it was so beautiful the way that you said that you keep finding things. You've changed over time. The scientist that you were 20 years ago is certainly different from the man of today. And you have continued to challenge yourself where you found that there was a vacuum and you had a message to offer. And then you started to write the books, and, you've never written a book before, but now you're learning those new things. So you continue to find things that I think must infuse the passion and the drive. And that is your balance. So that's our message to take away is, to stay passionate and to keep finding things that to move us forward, as difficult as they can be. To stay passionate and continue to.
Yeah. I mean, I think, in our professional life, and certainly in the academic health centers, there's a lot of pressure to stay siloed, because there's all of these incentives to stay in your silo and to write and speak for people in your silo, and by definition, then there's disincentives to do the other stuff. So, for instance, here, I get evaluated like everybody else does. And, because I don't see patients anymore, but so what do? They see me, okay, you're a biomedical scientist. What do they ask me about? They really want to know about my grants and my papers in high impact factor journals. And so you have to keep up with that. But, there's not even space on my annual review form for the books I've written or the public engagement. So sometimes you have to do things that are not even necessarily recognized by your peers, even though you think it's important. But I think the other message about that is changing the culture for how we think about science and public health needs to change. And that's, I think, going to be especially true for APIC members, who are so, they're so passionate about their commitment to infection prevention and public health. And yet, when, they try to have a voice in the community, they often get pretty beat up, either, not only by the people who oppose public health and vaccination measures, but even by their employers who don't understand that giving a voice to our APIC members is important. So that's a work in progress. That's going to take time.
Thank you for sharing that. So, Dr. Hotez, you briefly noted this several times regarding urbanization and climate change, and of course the implications of infectious disease spread. So, I want you to share with us what is, from your purview, how will this play a role within the field of infection prevention and the future of infection prevention, and what advice would you provide us as IPs for this inevitable future?
Well, what I would say is, the landscape for pandemics and the landscape for epidemic infections has changed, and now these are important drivers, and yet we're not training people to think in those terms, and we're not providing infection control experts with information about climate change and urbanization and deforestation and rising anti-science aggression. So, but those are going to be the new realities, and I sometimes call them Anthropocene forces, this human-made new geological epoch that we're in right now is driving disease. And so I think it's always going to be important, just like, I've had to reinvent myself, not only as a scientist, but as a writer. So we're going to have to reinvent our infection control experts too, to adjust to some of these new realities, and to do it in a way with joy and excitement, that it's going to be fun learning some of these new things, but it will take time.
So, with you noting that the reinvention of the IP, and that sounds like maybe a book or something, but in order to reinvent the IP, I'm curious to know, because one thing that I'm not sure if you're aware, but one of the challenges that we're facing is that 40% of the IP workforce is, leaving the profession, albeit through measures such as retirement. So, with that fact, how would you propose, maybe from your insights, what can you share with us IPs on how can we proceed with that, with reinventing our role?
Well, I think, one of, and I am concerned about the burnout. There's also burnout in all of the health professions, not only IP. And I think one thing that we need to do is to tap into the fact that the commitment to public service among young people is at an all-time high, and at the same time, and they've been under attack, those people in infection prevention. But I think providing them with a new set of skills and tools to better equip them, to help them understand what digital hate is all about, and how to counter and to expect digital hate, but also recognize that it's not you, that's the world we live in, and how to mitigate against it, but also recognize that there are new drivers for infection, like things like urbanization and climate change and deforestation, all those things we've been talking about. And I think they'll embrace that. I think that they'll want to learn it, and they'll want to see themselves as key players in this new world, that we're not just siloing them into what traditionally has been known as IP, but recognizing IP is totally different. It's a different game from what it was before the pandemic. And that was actually happening even before the pandemic, but now it's really obvious. And explaining to people that they are heroes, that pandemics are maybe that and climate change are probably two of our greatest threats to society right now, and remind them that they are heroes on the front lines of this, and give them the tools they need to take on this new normal.
Absolutely. I wanted to know, from your purview, do you see that there's a gap in education in the curriculum, maybe in public health? And of course, APIC is fervently working to develop IPC programming within institutions for a bachelor's and master's degree. So do you believe that there's a possible area of an opportunity in developing programming to garner in-depth understanding for future IPs and current IPs regarding urbanization and climate change?
I do. And I think, we're still teaching IP like we did 10, 20 years ago. And it's sort of, and not obviously, not all places are the same, but too often, I think it's done without that kind of situational awareness of how the world has changed and how urbanization and climate change and digital hate are transforming the landscapes. And so broadening the skill set to give them the tools to handle that, I think they'll love it, if you give them that opportunity. Because I see it when I give talks or grand rounds to other institutions and I talk about some of this stuff. You see the light bulb going off and they say, yes, why hasn't anyone ever spoken to us about this? And also career counseling and mentoring and telling, trying to give people choices in terms of what they can do with their lives over the next 10 to 15 years in terms of problems to solve. So I do think there are ways to do it. But we were going to very much need to bring in people from other fields to help with that traditional IP. I mean, the epidemiology is still important, obviously, and the understanding microbiological concepts are still going to be very important. But we're going to have to fold in some of these new things.
I agree with that. Back to that statement that you made earlier about the multidisciplinary effort and not siloing our sciences. So starting to get those interacting, as early as we can in the university setting or even in the high school setting, as we prepare this new generation to lead the charge.
Absolutely. And and to say that IP is really cool and it's really important. I know I'm preaching to the converted here, but I think we need to freshen things up a bit too. And I think there are those, and there are places that are doing this, and I clearly see that. But it's going to take time to fully build it in.
I agree. I think it'll take time. And I think that messaging that you're providing on social media, in your books, in the media interviews that you've been doing, that provides the framework for us as professionals in the IP community to then share that with the people that we train and bring into the field as well. So it will take time. But I really appreciate the impact that you have had and what you have shared with us so that we can carry it on.
Well, thank you. As I say, you're all heroes, and I have deep admiration for what infection prevention people go through, and those who are trained in it, what APIC has done. And so anything I can do for the organization, I'll be excited for that opportunity. So thank you.
Thank you, Dr. Hotez.
Thanks for listening to APIC's 5-Second Rule Show. We want to hear from you. Visit us at www.5secondruleshow.org. That's with the number 5, where you can contribute to the conversation. Make sure you subscribe and rate us wherever you listen to your podcasts. We're so appreciative of the hard work each of you do every day to make a safer world through infection prevention. Remember, IP stands for Important Person. You are awesome. Stay safe, and we'll see you next time.